Hello friends, I am Professor Smita Jha from the Department of Humanities and Social Sciences, and I am here to discuss health and disability in humanities. We are discussing, introduction to histories, theories, and methods in medical and health humanities, and we have discussed some of the theories as well. Uh, why I am very curious to discuss this particular course because medical humanities is an interdisciplinary field, in the present age of artificial intelligence, robotics, integrating literature, arts, philosophy, ethics, justice, and social sciences into medical sciences and practice. Uh, we have also discussed that how it integrates philosophy, ethics, psychology, social norms, because medical science is something that explores human body. And exploring human body is something dealing with not only with the inner psychology of a person, that is the thought process, and also the pathological part of a body, but the cultural environment in which he or she belongs, the family, the economic background. This all determine the whole body system of a person. Let us see what are the factors that determines the true nature of health disability in humanities. Well, in the previous lecture, we have started a discussion on the core theories constituting health humanities. Continuing with the same, we shall look at the next core theory now. And I told you that in any research, three paradigms very important, that is epistemology, ontology, and critical theories with methodology. So epistemology, that is the part of philosophy, that is the part of knowledge, that is the part of understanding, while ontology, that is the justifying things. And this is how I'm delivering my talk, my lecture, or in a way you can say that I'm sharing my knowledge on this given topic with you, comprising all these. That is epistemology, ontology. And critical theories are very important because any research, any new field, emerging field needs to be very logical analysis or to be analyzed logically, philosophically, and for that a lens is required that is scientific. And in my opinion, one of the paradigms, that is critical theories, school of thought, very important to justify the understanding of any study. So let us see different aspects. So I would like to start with social constructionism, as social constructionism in health humanities posits that health, illness, and medical knowledge are created through social interactions, cultural meanings, and power dynamics rather than being solely objective biological facts. And this is what I was talking about. Man is a social animal. He or she cannot live alone. And in a society, a personality is being, influenced by several factors that also determines one's physical as well as health, mental health. And therefore, it is utmost important to know about the social construct of any society to determine the nature of health humanities. Social constructionism is a theoretical framework that argues health and illness are not just biological facts, but are products of social, cultural, and historical context. Cultural, the way one eats, behaves, understand things, develop beliefs, develop emotions. That is why even IQ, intelligent quotient, emotional quotient, are very, very important to determine one's mental health and physical health. While medicine often focuses on the psychological aspects of a disease, social constructionists examine how society defines what health looks like, how patients experience being ill, and how medical knowledge itself is created. Very true, because even a doctor wants to know the family tree of a patient and therefore determines, the very mental climate of a person, because everything happens from the brain. Even though someone is ill due to some ailment, chronic illness, but it is mental, the brain that stimulate how to react towards a particular disease. Furthermore, it analyzes how society defines disease, experiences illness, and constructs medical knowledge that reflects social values. Now, what are the key aspects of this theory include? Cultural meaning of illness. Because in humanities, cultural study is very, very important. So let us see that what is the meaning of illness if we examine from the point of view of culture. Certain conditions are heavily influenced by cultural interpretations, which dictate how society views and responds to afflicted individuals. Constructing the illness experience. And this is what I said, that when a person falls ill, he or she is guided, governed by the mental pressure, the thought process, the cognitive part, and how a person fights against some chronic illness. That all depends, as we say, willpower, and how one develops the willpower, that depends again the thought process and cultural aspect also. So, health is managed through the personal, social, and subjective ways individuals experience and live with their illness. Medical knowledge as social construction. Medical knowledge is not merely discovered, it is built through social processes, reflecting societal structures, inequalities in class, race, and gender, rather than purely objective reality. Examples of social construction include how medical perspectives have changed over time regarding women's health and societal views of illness like AIDS. This perspective, see, point of view, focalization, perspective, very important. So, this particular perspective offers a crucial critique of purely biomedical approaches, suggesting that understanding health requires looking at the socio-cultural and political context, according to Springer Nature Link and the National Institute of Health, which is pioneer in the area of medical study. So, what are the core concepts in social constructionism? In the health humanities, as defined earlier, social constructionism is a theoretical framework that argues health and illness are not just biological facts, but are also shaped by social, cultural, and historical context. See how important it is. It is not only biological, but social, cultural, and historical context. How individuals perceive and live with a disease is influenced by their social environment. For example, one culture might see pain as something to endure silently, while another encourages vocal expressions. Certain myths are also there regarding some, diseases, especially in our country, how to deal with. We also call it naturopathy. So this naturopathy, some cultural specifics, treatment are very, very important to understand. Moreover, as per this model, medical facts change over time based on social values. For example, there has been a historical shift in the conception of pregnancy that was once treated as a delicate medical condition requiring total rest, while today it is viewed as a normal physiological process. There is also an attempt to demedicalize. For instance, homosexuality was classified as a disorder in the DSM until 1973, showing how social progress can undo medical levels. Thus, social constructionism challenges the purely objective view of modern medicine by showing how society defines what it means to be sick or healthy. Along with these conceptualizations of social constructionism theory of health humanities, there are three main frameworks or pillars within this theory that are categorized by sociologist Peter Conrad and Christine Barker. These three frameworks are namely the cultural meaning of illness that highlights how society attaches a specific meaning to certain conditions that aren't purely biological. There is also stigmatization that elucidates how some illness, like HIV, AIDS, or mental health disorders, carry a social mark that affects how both the public and healthcare providers treat patients. And there are the contested illness that point towards how some conditions like chronic fatigue syndrome or fibromyalgia are questioned by medical professionals, leading to a battle for legitimacy. Now let us get into greater detail on these frameworks or pillars individual, because these are not unusual term, but then these are common, but then we need to understand, with some example and situation. So what are the key pillars of social constructionism in health humanity? So as mentioned earlier, sociology, Conrad and Barker in 2010 identified three primary ways that health is socially constructed. Cultural meaning of illness. Some illness carry social stigmas that exist independently of their biological systems. For example, conditions like HIV, AIDS, or mental health disorders often carry cultural baggage that affects how patients are treated by society and healthcare system. Social construction of the illness experience. This refers to how individuals live with and understand their condition based on their social environment. For example, a long term illness might be seen by one person as a loss of self, while another might view it as an opportunity for discovery. Social construction of medical knowledge. Medical facts are not neutral, they reflect the values and inequalities such as gender, race, or class of the time they were created. An example is how medical advice for pregnant women has shifted dramatically over generations based on changing social norms rather than just new science. Then, core concepts and thinkers. Let us know the key theoretical drivers of social constructionism. The sick role. Proposed by Talcott Parsons, the sick role concept suggests that being sick is a social role with specific rights, like being exempt from work, and obligations, like trying to get well. Medicalization, this is the process by which normal human experiences like aging, childbirth, or sadness are redefined as medical problems needing expert intervention. Power dynamics. Thinkers such as Michel Foucault argue that medicine functions as a form of social control in which expert knowledge is used to categorize and discipline bodies. Further, arguing how medicine acts as a form of biopower used by society to monitor and regulate the human body. This is also very important to know about, health humanities. Contested illness, some conditions like fibromyalgia or chronic fatigue syndrome are called contested because their legitimacy is questioned by some in the medical community, illustrating how social recognition is required for a condition to be treated as a real illness. Thus, using this social constructionist lens, researchers can critique existing healthcare systems and reveal how power imbalances lead to poorer health outcomes among marginalized groups. It helps practitioners move beyond a purely biological view of the patient to understand the complex social world that shapes a person's well being. Furthermore, it also has a considerable impact on health humanities. Social constructionism shifts focus from the disease, the biological pathology, to the illness, the human experience of disease. It allows researchers to critique health inequalities by looking at how power, race, and gender influence who gets diagnosed and how they are treated. Now we come to the next core theory of health humanities, which is post humanism. Post humanism is one of the emerging theories these days and very important to apply even on the genetics and the clone study. So let us know about post humanism. Post humanism critiques traditional human centered, anthropocentric healthcare by emphasizing the interdependence of humans with technology, environment, and other species. It shifts focus from individual, autonomous patient narratives to a more than human perspective, integrating the role of medical technology and complex networks in health experiences. So, let us know about the key aspects of post humanism in health humanities. And these include challenging humanism. It questions the humanist ideal of autonomous individual, recognizing that patients are always entangled with technology, that is, devices, medication, artificial intelligence, and their environment. Non human actors. Post human health study consider the role of human entities like medical machinery, algorithm, and biological agents as active participants in health experiences. Then comes rethinking subjectivity. You all know that subjectivity means something very personal, poetic in nature. It is not scientific. It re examines medical empathy for focusing on the disabled, technological, interdependent body rather than an idealized, rational, and complete human body. Then comes critical medical humanities. This approach merges the critical perspective of post humanism with healthcare, aimed at identifying the biases in traditional medical humanism and addressing the needs of a diverse, interconnected world, according to a paper on public medicine and another from PMC. Beyond individual care, this is another perspective on posthumanism, it shifts the focus from purely interpersonal critical encounter toward broader complex networks that affect health, such as ecological systems and the more than human world, given by Springer Nature article. Coming to areas of research and practice with posthumanism. Disability studies defines posthumanism, a way to value non normative bodies by viewing tools like wheelchair as equal partners in a person's mobility rather than just aids, than speculative fiction. And this is very popular in the present days in the area of research of humanities. So, literature and film like Gattaca or Elysium are used to explore future ethical dilemmas involving genetic engineering and healthcare inequality. So, it is very important to know the Gattaca and the Elysium. Coming to global health politics, scholars use this lens to investigate how healthcare systems can dehumanize marginalized groups through neoliberal ableism and healthism. The idea that health is an individual's moral responsibility rather than a systematic issue. So, if we talk of theoretical distinctions that must be kept in mind are posthumanism versus transhumanism. So, posthumanism, as we discussed, is a critical theory that questions the very definition of human and seeks to dismantle hierarchies. And transhumanism focuses on using technology to enhance the human body and overcome biological limits like aging and death. Aging, that is gerontology and aging itself, is a very important area while discussing, health humanities or disability. Coming to critical medical humanities as part of posthumanism, this second wave of the field uses posthumanist tools to critique the biases of traditional medicine, such as its historical focus on white, male, and able bodied norm. Then, coming to the key concepts in medical posthumanities. Decentering, you see the coining of the terms posthumanities, posthumanism, medical posthumanities. So, decentering the human, unlike traditional medical humanism, which focuses on the doctor patient diet, posthumanism considers non human actors such as medical technologies like MRIs, dialysis machines, viruses, environmental factors, and animals as active participants in the health process. The posthuman body, if we talk of posthuman body, the body is viewed as a hybrid assemblage of biological, technological, and environmental elements. And see, donation, the organ donation, a symbol of the various organs. Now, even the lungs that can be donated, that can be assembled. So, it is biological, technological, and environmental elements. This includes everything from the trillions of microbes in the gut to implanted biotechnologies and prosthetic limbs. If we talk of posthuman care, this reimagines care not as a transaction between two people, but as an entanglement of social and material relations. This includes exploring caring machines like social robots and pirate care. Networks that provide mutual aid outside of formal state systems. One Health approach, if we talk about post-humanism, supports a One Health perspective that connects human health to the health of animals and the environment, especially critical in the context of zoonotic pandemic and the climate crisis. We now turn to a detailed analysis of these key aspects of post-humanism, focusing on its interdisciplinary association and the critical implications of decentering the human within health humanities. Decentering the human, we discussed just now, decentering the human in health humanities represents a critical shift from traditional anthropocentric, human centered care towards a more than human perspective that accounts for broader ecosystem, technological agents, and marginalized perspectives. While medical humanities historically humanize medicine by focusing on the individual patient's experience, the move toward health humanities incorporates post-humanist, critical, and relational approaches that emphasize entanglement with non-human elements such as technology, environment, and microbes. Decentering the human indexes a confluence of developments in the humanities relating to wider social and especially social environmental concerns, which call for giving more recognition to non human beings and entities. Within this, the Anthropocene anxieties about climate catastrophe and the associated need to develop approaches and ethics that go beyond immediate human interest have been major impulses. Moreover, there has been the material turn accompanied by aspects of ontological turn, the digital and especially artificial intelligence, and the less human centric perspectives of others, particularly some indigenous works. These numerous concerns in various ways challenge the humanities to examine their remit and premises and even to transform into what some call the post-humanism. Now, why there is a need to decenter the human? This is a very prominent question, significant question. While medical humanities often focuses on humanizing the doctor-patient relationship, health humanities uses decentering to address larger systematic and global issues like climate change, social justice, and the ethics of artificial intelligence. This ensures that humanity is not sacrificed to efficiency while recognizing that human health is inextricably linked to the health of the planet and its non human inhabitants. Coming to the key aspects of decentering the human within posthumanism, firstly, there is a more than human approach that problematizes human privilege and accounts for multi species cohabitation, recognizing that health is interconnected with non human agents. Secondly, the beyond human centered design highlights that in the context of health technologies and artificial intelligence, decentering challenges the focus on the user to understand how human concerns are entangled with larger technological systems. Thirdly, there is a critique of humanism that, drawing on feminist post-humanism, challenges the traditional construction of the human, often implicitly white, male, able bodied, and questions binaries like human animal, human machine, and organic synthetic. Fourthly, there is an aspect of relational subjectivity within post humanism that views the subject not as an independent entity, but as a relational and embodied entity constructed amid many material actors and agencies. Coming to the methodological shifts and applications regarding decentering the human. Reparative reading, moving away from paranoid, critical, suspicious reading. This approach involves a compassionate engagement, placing trust in both the narrator and the illness narrative. Empathetic artificial intelligence integration. It says as artificial intelligence grows in healthcare, Health Humanities aims to guide its integration to ensure that technology complements empathetic, compassionate care rather than replacing human interaction, ensuring that care is still humanized even if not exclusively human centric. Material discursive focus, which speaks rather than just studying narratives about illness, this approach examines how non human elements such as machine, viruses, infrastructure shapes the experience of health. Polyphonic narratives drawing from environmental studies, this approach includes the voices of non human agents, that is, fungi, microbes, in understanding ecological health and disease transmission. Now, there are certain approaches and methods employed to decenter the human within post humanist health humanities. Conceptual approach. This approach aims at applying humanities based scholarship, that is, philosophy, history, or a specific medical domains. Reverse methodology. This approach involves using tools from the arts and humanities to analyze and solve problems within medicine, such as using literature to explore patient suffering. Next, pedagogical approaches. This approach involves implementing literature, art, and film in medical education to foster empathy and reflective practice. Fourth, historical analysis. This approach provides, interprets, and preserves medical history to act as memory keepers and challenge present day assumption in medicine. Then comes narrative theory, the idea that humans understand their lives through stories. Illness is seen as a narrative wreckage that needs to be reconstructed. Sixth, phenomenology. This involves studying the lived, subjective experience of body and pain rather than just clinical data. That is the first hand experience point of view. Critical medical humanities, it refers to a newer wave that uses feminist, queer, and post colonial theories to critique how power and politics shape healthcare. Close reading. This involves analyzing patient charts, literature, or film to pick up one nuances, metaphors, and unspoken emotion. Then qualitative research, it involves using interviews and ethnography to understand culture beliefs about healing. Visual analysis, it includes studying how the body is represented in art and medical imaging to identify biases. Reflective practice, this involves using creative writing or journaling to help practitioners process the emotional moral distress of their work. Coming to practical strategies for decentering, scholars and practitioners use several dimensions to enact this shift. First is through multi-species approaches that involves prioritizing the health of the ecosystem rather than just human welfare. Second is through thing centered ethnography, which involves using objects as things as their starting point for research to understand how non human forces shape health outcome. Third is through an epistemological shift that includes moving beyond human only knowledge to include situated knowledges from marginalized groups and non human collaborators. Fourth is through embracing friction and discomfort that encompasses using design practices to challenge the expert stance of the human designer, doctor, often through methods like autoethnography and noticing. With this, I wrap up the discussion for today. And the next lecture, I would like to discuss many more theories, aspects related to health and disability humanities. Thank you once again.